Dementia is one of the nation's most expensive old age health conditions and the most time-consuming for family caregivers. Currently, more than 6 million Americans aged 65 and older are living with Alzheimer's disease, and this number is projected to nearly triple to nearly 18 million by 2050, posing an immense challenge for families, caregivers, and the healthcare system. According to the Alzheimer's Association, about 70% of people with Alzheimer's or other dementias will eventually require long-term care. According to the CDC, 80% of people with Alzheimer's or other dementias are receiving care in their homes, whether it's home care or hospice. How will this impact family caregivers? How does this impact our healthcare and long-term care systems, especially over the next decade? Let's find out. Welcome to Aging Together, a podcast dedicated to exploring the challenges and opportunities of caring for our aging loved ones. This podcast is a product of Caregiver Consulting and Healthy Solutions, a private consulting practice dedicated to helping you navigate the aging process with ease. Together, we will dive into a wide range of topics, including health and wellness, financial planning, caregiving, and more. This podcast is for everyone, whether you are an older adult looking to age in place, a caregiver seeking support and guidance, a young or middle-aged adult planning for the future, or simply someone interested in learning more about the aging process. I hope you'll join me on this journey. Let's navigate aging together. What's up, everyone? I'm your host, Pooja, and you're listening to Aging Together. November is National Family Caregivers Appreciation Month and National Home Care and Hospice Month. It is also National Alzheimer's Awareness Month. This is a big deal because it's a time to really understand what Alzheimer's disease means for our families and the healthcare system in America. Alzheimer's, a progressive neurodegenerative disorder, not only affects individuals, but also reverberates across families, communities, and the healthcare system as a whole. In this episode, I'll explore the projected burden of Alzheimer's on family caregivers and the growing demand for long-term care, addressing its prevalence, disparities across different demographics, and its foreseeable impact on the U.S. healthcare landscape over the next decade. Let's start with understanding Alzheimer's disease. Alzheimer's disease is the most prevalent form of dementia, and it relentlessly breaks down cognitive abilities, impacting memory, thinking, and behavior. According to the Alzheimer's Association, over 6 million Americans aged 65 and older are currently living with Alzheimer's, and this number is expected to nearly triple by 2050. Presenting a substantial challenge for families and healthcare systems alike. However, beyond the statistics lies a concerning reality: the disproportionate burden experienced by different ethnic and minority groups. Research suggests that African American and Hispanic communities bear a higher risk of developing Alzheimer's, often facing delayed diagnoses and limited access to resources compared to their Caucasian counterparts. Let's dive into this a little further. The disparities related to Alzheimer's disease across different ethnic and minority groups in the United States are concerning. Big picture, Alzheimer's doesn't play fair when it comes to different groups of people. African American folks have a higher chance of dealing with Alzheimer's compared to others. The tricky part, they often don't get diagnosed as quickly. This delay happens because talking about mental health isn't always easy. And sometimes there aren't enough resources within the community to get the right help. Research indicates that African American communities face a higher risk of developing Alzheimer's disease compared to their Caucasian counterparts. Studies suggest that genetics, socioeconomic factors, and disparities in healthcare access contribute to this increased risk. Within these communities, delayed diagnosis of Alzheimer's are prevalent due to various factors, including stigma surrounding mental health issues, lack of awareness, and cultural beliefs that may hinder seeking timely medical help. African American individuals and families affected by Alzheimer's often encounter barriers in accessing adequate resources for diagnosis, treatment, and support. Socioeconomic disparities and healthcare inequalities may lead to reduced access to specialized care and support services. Hispanic communities are in a similar boat. There's a higher risk of getting Alzheimer's, but getting the diagnosis can be a bit of a hurdle due to language barriers and not enough awareness about the symptoms. Finding the right care that fits the cultural background can be tough too. Studies suggest a potential combination of genetic factors and lifestyle differences contributing to the increased susceptibility. Similar to African American communities, Hispanic individuals often experience delays in diagnosis. Cultural perspectives, language barriers, and lower health literacy levels may contribute to delayed recognition and treatment of symptoms. Now, when we look at the Asian American and Pacific Islander communities, the story is a bit different. Some groups within this community might have a higher risk, but getting help might mean dealing with language issues and cultural beliefs that might not match up to Western medicine. Research on Alzheimer's in Asian American Pacific Islander communities is evolving. Studies suggest that certain subgroups within the API community might be at a higher risk due to genetic factors and potential lifestyle differences. Again, those language barriers, cultural beliefs, and a lack of awareness about Alzheimer's symptoms may contribute to delayed diagnosis within the API community. Stigma associated with mental health issues might also hinder seeking timely medical attention. And similar to Hispanic cultures, accessing culturally competent care and support services can be challenging for some subgroups due to language differences and variations in healthcare utilization patterns. And finally, moving into Native American communities. Some research indicates that these communities may have a higher prevalence of certain risk factors for Alzheimer's disease, including cardiovascular conditions and diabetes, which can increase susceptibility. Limited access to healthcare resources in some Native American communities, geographic isolation, and cultural beliefs may contribute to delayed diagnosis of Alzheimer's disease. And challenges in accessing specialized care, diagnostic facilities, and culturally appropriate support services further exacerbate the burden of Alzheimer's within Native American communities. These differences are tough because they mean some groups have a harder time getting the help they need. It's not fair, and it's something we've got to work on together as a community to make sure everyone gets the right care and support, no matter where they come from or what language they speak. When we talk about an impact on family caregiving, Alzheimer's not only affects the diagnosed individual, but significantly alters the lives of their caregivers. Family members, often spouses or adult children, become the primary support system, shouldering immense emotional, physical, and financial responsibilities. The demands of caregiving can be overwhelming, leading to stress, anxiety, depression, and compromised health for the caregivers themselves. The strain on family caregivers is exacerbated by the prolonged nature of Alzheimer's, with care often spanning several years or even decades. If you want to learn more about specific physical and emotional demands of family caregiving, tune into episode 43. Let's talk about long-term care. As Alzheimer's progresses, most people eventually need some kind of long-term care. This means specialized care at home or in a care facility. With the number of people needing this kind of care skyrocketing, our healthcare system is going to feel the heat. It's not just about the money, it's about having enough places and people to provide the right care. The cost of long-term care, combined with the increasing number of individuals requiring it, presents a looming financial burden for families and the broader healthcare infrastructure. Understanding care options for Alzheimer's and other dementias early on is crucial for several reasons. It's like having a game plan, and the benefits extend significantly to the affected individual and their family. Here's a few of those benefits. First, better planning and decision-making. Planning ahead and making decisions together, when you know the care options early on, it's like having a heads up. You get time to sit down and talk about what your loved one wants in terms of care. This includes their preferences, where they'd like to live, and how they'd like to live, and how they'd like to be taken care of. It's important to have these conversations early while they can still be a part of that decision-making process. Second, accessibility to available resources. Knowing about care options means you're not alone in the journey. You can find support groups, services that offer a break for caregivers called respite care, and even get training on how to handle certain situations that might come up. This kind of support makes a huge difference in how you manage things day to day. Third, improving quality of life. Getting a jump start on care options can help improve not only your loved one's life, but yours too. There are treatments and strategies that can help manage symptoms and slow down the progression of the disease. This may include medication, therapies, and lifestyle adjustments that can positively impact the individual's well-being. Knowing about these options early means you can start implementing them to make life better for them and for you. Next, reducing caregiver stress and burden. Being in the know about care options isn't just good for the person with dementia. It's a game changer for caregivers too. It means access to services that can help reduce stress and offer practical tips to manage caregiving. This way, caregivers don't feel overwhelmed and can provide better care. Next, financial and legal preparedness. Early knowledge of care options enables families to address financial and legal matters, such as arranging for long-term care insurance, setting up advance directives, and establishing power of attorney. It's not the most fun stuff, but knowing care options early helps sort this stuff out in advance. This proactive approach helps in managing potential financial challenges and ensures that the person's wishes are respected regarding their care and their finances. And lastly, maintaining dignity and autonomy. What that means is you're respecting the wishes of the person and keeping their dignity. When everyone knows what the care options are, it lets the person with dementia have a say in their own care while they're still able to. This way, their wishes are respected, and they keep their dignity intact by having a say in what happens to them. In essence, gaining an early understanding of care options for Alzheimer's and other dementias empowers families to plan effectively. It also helps them access appropriate support and provide the best possible care while respecting the individual's wishes. It significantly contributes to enhancing the overall well-being of both the person with dementia and their caregivers throughout the progression of the disease. Now, I mentioned financial and legal implications, and I want to go a little bit more into that. So financially, the financial side of long-term care can be a real eye-opener for families. Let's break it down. On average, home care services can set you back about $25 per hour, but this can vary based on location and the level of care that's needed. For instance, if your loved one needs full-time care, that can rack up quite a bill. Now, if you're thinking about assisted living, now you're getting ready for an average cost of around $4,000 to $4,500 per month. Yeah, it's a chunk of change, and that's just the average. These costs can be overwhelming and add up pretty fast, especially if your family hasn't planned for it. So understanding these figures up front is crucial for families to figure out how to manage these expenses without breaking the bank. To learn more about financial implications of long-term care, tune into episode 42, where I spoke with a certified financial planner on exactly this topic. Now the legal side. Navigating the legal side of long-term care can feel like wading through a maze. Insurance coverage for long-term care isn't always a given. Your typical health insurance may not cover long-term care services. That leaves families to foot the bill unless they've got long-term care insurance. But long-term care insurance isn't a guarantee either, and it often depends on what's covered in that policy. Some policies might cover home care, assisted living, or nursing home care, while others may not. So it's like reading the fine print on a contract. You've got to know what's in there. On top of that, there's a thing called Medicaid, which might cover long-term care, but there are eligibility hoops to jump through. That's why families need to get legal advice early on so they can figure out the best way to navigate these complex waters and protect their loved ones while avoiding financial strain. To learn more about the legal implications of long-term care, tune into episode 44, where I spoke with an elder law attorney on this topic. Now that you understand the current state of Alzheimer's care and your care options, let's look at the road ahead. The Alzheimer's epidemic in America is poised to have a profound impact on both family caregivers and the healthcare system. The projected impact of care burden on family caregivers over the next 10 years is expected to intensify significantly. As the population ages and the number of individuals living with Alzheimer's and other dementias continues to rise, the burden on family caregivers is poised to increase substantially. The sheer volume of individuals needing care, combined with the prolonged duration of caregiving, will heighten the physical, emotional, and financial strain experienced by caregivers. Moreover, the shortage of formal care services and the escalating cost of long-term care could further exacerbate the burden on families. Without adequate support systems and interventions in place, family caregivers are likely to face increased stress, increased health risks, and greater impact on their quality of life. Without comprehensive strategies to address the escalating needs of Alzheimer's patients and their caregivers, the strain on families and healthcare systems will intensify. It's crucial to advocate for increased funding for research, enhance accessibility to culturally sensitive care for minority groups, develop support systems that alleviate the burden on family caregivers, and encourage proactive care planning to minimize burdens. Collaborative efforts between healthcare providers, policymakers, and community organizations are imperative to create a more sustainable and compassionate approach to managing Alzheimer's and its implications. So I mentioned 4 main areas here that could help us in the road ahead. The first is research funding. The state of research funding for Alzheimer's disease and other dementias has seen an increase in attention and funding in recent years, but many experts believe it's still not enough. The truth is, these diseases are taking a heavy toll, and research is key to finding better treatments and hopefully a cure. The U.S. government has been stepping up its game, pumping in more money for research through initiatives like the National Plan to Address Alzheimer's Disease. These efforts have brought about some promising developments in understanding the diseases and potential treatment avenues. However, despite these advancements, the funding gap remains substantial compared to the colossal impact these diseases have on individuals, families, and the healthcare system. Advocates are pushing for more significant investment in research to accelerate progress, find better therapies, and ultimately work towards preventing and curing these devastating conditions. Next, I mentioned culturally sensitive care. Enhancing accessibility to culturally sensitive care for minority groups dealing with Alzheimer's and other dementias is a crucial step towards providing equitable support. It's about recognizing that one size doesn't fit all when it comes to care. To make care more inclusive and effective, we need to bridge the gap by understanding cultural beliefs, language preferences, and unique needs within diverse communities. This means training healthcare professionals to be culturally aware and sensitive, providing language-specific resources and materials, and ensuring that care settings are welcoming and respectful of diverse backgrounds. Moreover, it's essential to involve community leaders, advocates, and families from these minority groups in the design and delivery of care services, ensuring that their voices are heard and their specific needs are being addressed. By doing so, we can create a more supportive and accessible healthcare environment that meets the diverse needs of all individuals affected by these conditions. Moving into support systems. Developing support systems that alleviate the burden on family caregivers is like offering a lifeline in the caregiving journey. These caregivers are the unsung heroes, but the load they carry can be heavy. To lighten that load, we've got to increase support systems. That means setting up support groups where caregivers can connect, share experiences, and get practical advice. It also involves providing respite care options to give caregivers a break. They need time off too. Additionally, offering training programs and resources on caregiving techniques and how to manage stress can be a game changer. It's all about recognizing the sacrifices these caregivers make and giving them the tools and support they need to keep going without feeling overwhelmed or alone. After all, a well-supported caregiver means better care for their loved one with Alzheimer's or dementia. And finally, proactive care planning. Proactive long-term care planning, when dealing with Alzheimer's and other dementias, can be a game changer for both individuals and their families. Financially, having a plan in place means fewer surprises down the road. It helps families manage costs better, access available resources, and avoid financial strain. Legally, it's like having a safety net. Setting up legal documents in advance ensures that everyone knows the game plan, reduces misunderstandings, and ensures the person's wishes are respected. Physically, planning ahead means access to better care options, making life easier for both the individual with dementia and their caregiver. Emotionally, it's a weight off the shoulders. Knowing what to expect and having a plan reduces stress, making it easier for families to focus on providing the best care and enjoying the time they have together. Ultimately, proactive planning sets the stage for a smoother journey, offering peace of mind and better support for everyone involved in the challenging journey of Alzheimer's or dementia. In commemorating National Alzheimer's Awareness Month and acknowledging the vital role of family caregivers during National Family Caregivers Appreciation Month, it's essential to recognize the multifaceted challenges posed by Alzheimer's disease. This month serves as a poignant reminder of the urgent need for concerted action to support those affected by Alzheimer's, fortify caregivers, and fortify our healthcare system to navigate the impending surge in Alzheimer's cases over the next decade. Through education, advocacy, and collective efforts, we can strive to build a more inclusive and responsive healthcare landscape that empowers both individuals living with Alzheimer's and their dedicated caregivers. Remember, knowledge is power, and together we can create a more compassionate and sustainable future for those impacted by Alzheimer's disease. At Caregiver Consulting and Healthy Solutions, we are dedicated to helping you navigate aging together. Thanks for tuning in, and I'll see you next time.